Hello, and welcome to the Healthy Life Self-Care and You seminar. I'm Dr. Don Powell, President and CEO of the American Institute for Preventive Medicine. Since 1983, the Institute has been a leading provider of health promotion and self-care programs and publications to over 12,000 organizations. We've also been honored by the Centers for Disease Control and Prevention and the President's Council on Physical Fitness and Sports. The Self-Care Guide you received is one of many publications written by the Institute. It's designed to help you live a healthier lifestyle, make better healthcare decisions, and save money on healthcare costs. The goals of this seminar are to help you learn three things. One, to learn about the benefits of using medical self-care. Two, how to maximize your use of the medical self-care guide you received. And three, how to be ready to practice medical self-care. I want to introduce Steve Byers, our Vice President here at the Institute, who will take you through the seminar.
Let's start with the first goal, to learn about the benefits of using self-care. Do you want to learn how to communicate better with your doctor, how to use medications safely, how to make wise medical decisions? If the answer is yes to any of these, your self-care guide is just what you need. It is also a quick reference to find out what to do when you or a family member has a health problem. Unlike a reference book with medical jargon that is hard to understand, your self-care guide is easy to read and easy to follow. And what you find out may even help save your life.
I want to tell you a story about what happened to me when I was at a Lowe's home improvement store a while ago. Lowe's distributes our Health at Home Self-Care Guide to all of its associates on its insurance plan. I was purchasing a kitchen faucet, and I asked Jeff Bilbrey, an associate in the plumbing department, if he recalled receiving a copy of the Health at Home Self-Care Guide. He replied,
Not only did I use the book, but it saved my life.
Still, without identifying myself, I asked him how.
One evening about 1.5 years ago, I was experiencing stomach pain and vomiting. When the symptoms persisted until the next morning, I used the book to find out what to do. The book stated that with my symptoms, I should see a doctor. Well, by the time I saw my doctor, he said my body systems were shutting down, and he diagnosed me with acute pancreatitis. I was rushed to the hospital where I spent 30 days in intensive care. My doctor said I would have died had I not been treated when I was.
Then finally I identified myself, and Jeff replied,
Your book saved my life.
This example shows that using your self-care guide gives you the right information at the right time to help you do the right thing to take care of your health needs. Talking about health needs, are you paying more to take care of your health? More for health insurance? More out of your pocket for deductibles and copays? Have you noticed that services that were covered in the past are no longer covered? If you answered yes to any of these, use your self-care guide to help you save money. Your self-care guide tells you how to take care of common health problems yourself. Doing this can help you save money on unnecessary medical costs, such as costs for doctor visits and medicines that may not be needed. It also includes costs you may not think about, such as the cost of gas to get to and from the doctor's office and the cost of taking time off work. I want to make something very clear though. Saving money on healthcare isn't only about not going to the doctor's office, it's about getting the appropriate level of care. When symptoms suggest that you can treat a problem yourself, your self-care guide lists specific things to do. But when symptoms suggest that you need medical advice, your self-care guide directs you to get it. When you ignore symptoms or don't get help for a problem that needs medical care, the problem may only get worse and could end up costing more in the long run. One of our clients, an employee of a health system in Minneapolis, was glad she did not ignore her symptoms. This is what she told us.
I had been experiencing severe abdominal pain. I consulted my self-care book and was advised to go to the emergency room. I was diagnosed with ovarian cancer. Luckily, it was caught early, and after surgery and chemo, my prognosis is excellent. I credit the book for helping me decide the right thing to do.
In general, most health problems cost less to treat when they are detected early. They are usually easier to treat then too. Yet another benefit of your self-care guide is that it can help you save time. How much time does it take you to go to and from the doctor's office? How long do you usually sit in the waiting room before you get called in to see the doctor? Then, how long do you wait in the examining room? By using your self-care guide, you may find out when a doctor visit is not necessary. If you need to see or call the doctor, your self-care guide has tools to help you communicate well with your doctor so you can make the most out of the time you spend with him or her. Let's look at an example. In the table of contents of your self-care guide, find Tell and Ask the Doctor/Provider checklists. Go to these pages. These are a summary of what to tell and ask your doctor or healthcare provider on the phone or at an office visit. Checklist 1 summarizes things to tell your doctor. The first thing on the checklist asks for your signs and symptoms in the order that they occurred and what makes them better or worse. The more information you give your doctor, the more accurate his or her diagnosis will be. In fact, according to the American Society of Internal Medicine, 70% of a correct diagnosis depends on what the patient tells the doctor. It was also found that those who wrote down their questions before a visit left the doctor's office feeling less anxious about their medical conditions and more at ease with their doctors. So use checklists 1 and 2 in your self-care guide to help you better prepare to communicate with your doctor. Make copies of these, fill in the items you want to discuss with your doctor, and take these to the office visit. When your doctor sees that you have a list of questions or concerns, he or she is more apt to conclude that you are actively involved in your healthcare decisions. Use checklist 3 to write down what to do after your visit. It is very important to follow your doctor's advice. To sum up Goal 1, use your self-care guide to help you make wise medical decisions for you and your family members. Following the tips in the guide can help you save time and money too. Goal number 2 is how to maximize your use of the self-care guide that you received. The first page is a good place to start. Use this to write down telephone numbers and information. Fill in the top part of this page as soon as you can. Don't put it off. After you do this, show this self-care guide to your partner and or other persons who you live with who should also know this information. Put the guide in a place where all of you can easily refer to it. Please turn to the next page of your guide. You need to be aware of the message after the note at the top of the page. Basically, this tells you that the information in the self-care guide does not replace expert medical advice or treatment and that you should follow your doctor's or healthcare provider's advice. Also, you should follow your doctor's advice if it differs from what the guide gives, and that you should call or see your doctor if the problem you are reading about doesn't go away after a reasonable amount of time. Now turn to the table of contents. The contents are listed in sections. Section titles include Wise Healthcare Choices, Common Health Problems, and Emergencies and First Aid. Your self-care guide may have additional sections. In your table of contents, find health tests and when to have them. Turn to this page. It gives general guidelines for adults. If you are at an increased risk for any illness, extra tests, such as the one to screen for diabetes, may also be needed. Testing may be done earlier or more often too. Let me state that you should follow your doctor's or healthcare provider's advice for tests and exams if it differs from what is given in your self-care guide. This holds true for all recommendations given in your guide. Find your age bracket and note those tests and exams that fall under it. Have you had these? Have you discussed screening tests and exams with your doctor or healthcare provider? If not, you should. Don't procrastinate when it comes to having routine tests. Early detection and treatment can save your life. Find out, too, if and when tests and exams are covered by your health plan. Also, as a wise healthcare consumer, ask why a test is needed, if it is a covered expense of your health plan, and how much you'll have to pay. Know, too, that some employers and community health fairs offer free or low-cost screening tests. Your self-care guide has an immunization schedule. It is important to keep your children's and your immunizations current. Did you know that adults should get a tetanus booster every 10 years? Have you had a tetanus shot within the last 10 years? Check with your doctor or local health department regarding other immunizations and when you should have them, such as a yearly flu vaccine, hepatitis A and B vaccines, and a vaccine to help prevent pneumonia. This is advised for persons age 65 and older, but persons with a chronic health condition, such as diabetes, may be advised to get this sooner. Know that guidelines for immunizations can change from year to year. You can find out about updates for vaccines and more information on them from the Centers for Disease Control and Prevention's website, www.cdc.gov/NIP. A very important part of meeting goal number 2, how to be ready to practice medical self-care, is to know how to decide when it is appropriate to seek medical care and/or use self-care. To help illustrate this, look in the table of contents of your self-care guide for the section titled Common Health Problems. Go to the first page of that section. Depending on the self-care guide you have, common health problems are listed in order from A to Z or are put into chapters with similar problems such as eye conditions, ear, nose, and throat problems, skin conditions, men's health issues, women's health issues, and so on. Information for each topic in the Common Health Problems section is divided into parts. 1. Facts about the problem, what it is and signs, symptoms, causes, and treatment for it. 2. Yes or no questions to help you decide if you should get medical care fast, see your doctor, call your doctor, or use self-care. And 3. A list of self-care and prevention tips to deal with the problem. For example, find the page for the sore throats topic and turn to that page. You will see information about sore throats under these headings: signs and symptoms, causes, treatment, and self-care and prevention. Look now at the questions to ask. Answering yes or no to these questions will help you decide whether it is appropriate to get medical care or to use self-care. It is very important to understand what the instructions and the symbols that go with them mean. If your self-care guide is titled Health at Home Lifetime, there will not be a questions to ask section. Instead, symptoms will be listed under each heading.
Hello, I'm Dr. Susan Schooley. I'm the chair of the Department of Family Medicine in the Henry Ford Health System. I'm also the medical director for the American Institute of Preventive Medicine, and I'm here to help you learn how to use your self-care guide.
Get medical care fast means the problem could be a medical emergency. A medical emergency could result in death or serious harm if you don't get prompt care. For conditions that could threaten life, get to the nearest hospital emergency room or call 911 or your local EMS. Signs and symptoms for these are listed in the Emergencies and First Aid section of your self-care guide. These are important, and I'm going to list them all again. Any heart attack or stroke warning sign. You'll see the list in the guide of these symptoms. A hard time breathing or shortness of breath. Fainting or loss of consciousness. A change in mental status such as unusual behavior or confusion. Sudden severe pain anywhere in the body. Bleeding that won't stop. Vomiting that is severe or that persists, coughing up or vomiting blood, or suicide attempts or gestures, or making plans for suicide or thoughts of suicide. Talking about getting emergency medical care reminds me of a letter we received from the wife of a husband who was having chest pain. Here's what she wrote.
My husband initially ignored the chest pain, but after I read my self-care book, I insisted he go to the emergency room. At the ER, he was diagnosed with having a heart attack. Surgery was performed within an hour. Had my husband not received immediate treatment, he would not be alive today. I credit my self-care guide with saving him.
Mary Jo Parsons, a pharmacy supervisor at Aurora Medical Center, is grateful for the Healthier at Home self-care guide that she received from her employer as part of its wellness program. She thinks it may have saved her husband's life.
My husband Jay felt unusual back pain after laying flooring in our garage. For relief, he took an Advil and a hot bath. Unable to sleep that evening, Jay noticed pain in his left shoulder and elbow. He got up, sat in the recliner, and felt better. On our coffee table was a copy of the Healthier at Home. As I sat up with my husband, I paged through the guide. On page 387, I noticed Jay's symptoms matched those of a heart attack. Using the self-care first aid section of the guide, I knew exactly what to do. I told him to take an aspirin and we'll go to the emergency room. It was a real lifesaver.
The reality is that the book itself did not save her husband's life. but reading it and following the advice given helped him get the appropriate level of care. Get medical care fast can also indicate conditions that do not threaten life, but need medical care or evaluation right away. For these, go to an urgent care center or call your doctor without delay. See doctor means the problem may need medical care, but not right away. A doctor may need to diagnose the problem. It may require medication or professional treatment so that it doesn't get worse or result in more serious problems. When we say doctor, that could mean your primary care physician, either a private physician or through your HMO. It could be your gynecologist or obstetrician for women, a walk-in clinic or an urgent care center, a physician's assistant or nurse practitioner, a certified nurse who works with your doctor. It could be a home health care provider, or even could be your dentist when appropriate. Obviously, if you have a primary care doctor or personal physician, you will need to call him or her first to request to be seen. Explain your signs and symptoms to the doctor's office assistant. If your doctor or healthcare provider cannot see you soon, ask where else you can go to be seen. If you do not have a personal physician, you may need to seek the advice of a healthcare provider at a walk-in clinic or call a local physician referral service. Check with your health insurance carrier for services and facilities that are covered by your health plan. See counselor or call counselor means to contact a mental health care provider. This could include your counselor or therapist if you already have one. It could be a mental health professional at your employee assistance program at your job. Many EAPs have mental health professionals who do brief treatment. It could also be a mental health center where a psychologist or social worker or any other healthcare provider in the mental health field, such as a psychiatric nurse, might be able to help. If you belong to a health maintenance organization or other managed healthcare plan, you may need to call your primary care physician for a referral to a counselor or other healthcare provider, including a psychiatrist. Also, a counselor may suggest that you join a self-help or support group. Call doctor indicates a less urgent situation, but one that your doctor really ought to know about. Depending on your medical history and current symptoms, your doctor may decide that you need to be seen or could send you to a facility for testing or prescribing treatment over the telephone or give you specific instructions to treat the problem. You won't know until you call. Let's look at a topic where these symbols are used. We'll use the questions to ask section for sore throats. Turn to that page again. Your answers to the questions point to the appropriate level of care you need for the signs and symptoms you have. Start with the first question. If you answered yes to the first question, you should get medical care fast because symptoms indicate a possible emergency. If you answered no, read the next question. If you answered yes to this question, you should see your doctor because symptoms suggest a problem that could require prescribed medicine to treat the sore throat. If you answered no, read the next question. If you answered yes to any of the questions within this set of questions, call your doctor for advice. You may need to make an appointment to be seen to diagnose the cause of the sore throat and get the appropriate treatment for it. If you answered no, you are directed to use self-care. Use self-care means you can probably treat the condition yourself. Use the suggested self-care tips in your guide. If after a reasonable amount of time, however, you do not find relief from one or more of these self-care measures, you should consult your doctor. Also, answering no to all of the questions in the flowchart may mean you do not have this particular medical condition, but you could have something else with similar signs and symptoms. When in doubt, consult your doctor. This brings us to goal number 3. Learn what to do to be ready to do medical self-care. Self-care prevention tips may suggest that you take over-the-counter medications, such as ones for pain. It's best if you ask your doctor which over-the-counter medications are safe for you to take and which ones you should not use. Then you'll know which ones to have on hand when you need them. To be ready for medical self-care, you should have some basic non-prescription medicines available. Your self-care guide lists these in the topics over-the-counter medications and your home pharmacy. Find out what pages these are on in section 1 or in the table of contents in your guide. In addition to over-the-counter medicines, you should also have some basic self-care supplies handy. These include bandages and an antiseptic for minor wounds, sunscreen, and a thermometer. Your self-care guide gives a list of basic supplies to help with self-care. Check to see that you have all of these. Being prepared to give first aid is also important to be ready to give medical self-care. The best way to be ready to give first aid is to learn basic first aid skills from first aid and CPR courses. These give hands-on practice in giving CPR and first aid the right way. Your self-care guide gives instructions on giving CPR, first aid for choking, and first aid for poisoning. These may be helpful, but they do not take the place of formal training in these life-saving procedures. You can find out about CPR and first aid classes from your local Red Cross or the local police, fire, and community education departments. Also, have a first aid kit in the house and in the car. If you have a boat, keep one there too.
In summary, being ready to give medical self-care means knowing what to do and having the required medicines and supplies for your situation.
Hi, this is Dr. Don Powell again. I want to thank you for watching this seminar, and hopefully the information that was presented in it, along with your self-care guide, will be of great benefit to you in protecting your most precious resource, your health. Always remember that no one will take better care of you than you. Good luck and be well.